to Shreen from Alpine Food Storage for hosting us. I love this location. This is great. So, for those of you who haven't been with us before, format is he'll do a presentation, and you can do a little bit longer if you'd like to, because we only have two of you speaking tonight.
Okay.
Dr. Earl didn't fit the dates right in his calendar, so he'll be with us next time. But
okay.
so 15, 20 minutes or so, and then we do question and answer period, where everything that you want to know about what he was talking about, then we'll ask. And so we have Dr. Branham today, and then his lovely wife Julie as well. So we're excited to have them both today. It's a family affair today. So thank you all. We're going to get started.
Thank you. I've met some of you, most of you, but not all of you. I'm a chiropractor. I've been practicing for over 30 years, and sometimes, like tonight, I perform instead of just practicing. I use a technique called applied kinesiology. Who's familiar with applied kinesiology? Most people have heard of it or seen it. It uses muscle testing. It's a way to communicate with the body, to get information, to get feedback. The theory of applied kinesiology was developed by George Goodhart, who is a real genius of a man, and I had the opportunity to spend a few years working with him. And he developed, and it wasn't new to him, but his theory was what he called the triad of health. That health is the basis of health, since he was a chiropractor first, was structure. He says if your structure isn't right, nothing else works right. The foundation can't hold up. But the equal sides of the triangle were chemical, which is, as we know, is all the chemical influences, both the good things you put into your body, the negative things that occur to you, toxic-wise and infection-wise. And then the third side of the triangle was what he called emotional or energetic. And I like to add a fourth side of the triangle and make it a three-dimensional figure, and we could call that spiritual or higher energetics. Hello, welcome. We might be able to make room in the back. There's couches on the side and there. And sorry, my table's in the way. I guess I could move my. And you could push my table this way a little bit, because I'm going to move.
Nice and cozy.
New faces.
Okay, welcome. I just introduced myself. I'm Dr. Corey Branham. I'm a chiropractor. I've been practicing 30 years, and I'm explaining a little bit about applied kinesiology or muscle testing, which is the primary diagnostic tool that I use. It's not the only diagnostic tool. It's not a therapeutic tool. It's used to assess therapies and decide what kind of therapies you want to apply to the body. So it's a way to talk to the body and get the feedback from the body. And I was talking about the triangle of health, the triad: structure, chemical, electromagnetic or emotional, and I like to add the fourth side, spiritual. So, and I'm sure as all of you that work with more subtle energies, or even just working with the body and being careful observers, you know that some days you're more tired than others, but some days it goes beyond that and your energy's sucked out. There are patients or types of people or phases of their life where they can be an energy vampire, or they can drain you. And just yesterday, I had that experience. I had a patient just before noon, and then all of a sudden I realized, oh, this is hard. And then afternoon I started working patients. This isn't working. Anything's not flowing. And that rarely ever happens to me. It used to be a lot more of my experience earlier on in my life, in my practice life. And I realized, what, this person was in a state of my energy. So my talk today, I don't energetic boundaries so boundaries are ways that you can protect yourself to keep your energy from being drained off. What energy are we talking about? You can call it lots of different names: chi, prana, life force, vital force. Then there's people that study the subtle bodies. I think it's most of the energy of the subtle body and the astral body. Who knows about the body? That kind of discussion. So the vital body is kind of the exact duplicate of every structure in the body. There are vital cells, vital organs, vital tissues, and that's within 6 inches of your body, that energy field. And the astral body, up to 18 inches, 2 feet out, and that's the area where emotions live and are developed and kind of hang out. And so when those fields are drained or depleted or opened for any reason, you're more subject to having your energy drawn away. So, I'm going to do a quick demonstration. I'm going to like to demonstrate things. Who wants to demonstrate? It doesn't matter who. Just stand up and come here. If they're comfortable having me test them in front of the group. All right. Hi, I'm Corey, and your name is?
James.
James. Okay, James, let me see. Where is it going to be best for me to stand for the camera? I work better from this side of the body, so I'm going to come over here.
Perfect.
And have you ever done muscle testing with anyone before?
Yeah.
You've seen it or done it, or do you do it yourself?
No.
Okay, but you had done it. Okay, so I'm going to have your old arms straight. You could use any good intact muscle, elbows straight all the way if you can. Push gently up into my hand. So he has a good intact nervous system muscle. He responds well. He holds good tone. I do a couple of checks. This is called, if anybody knows Touch for Health, these are the brain buttons. In applied kinesiology, it's K27 or switching points. I don't see any switchings. I touch here. I should get a little weakness, and I don't get quite the weakness I want. So I know he's not quite clear to test. I want you to turn your head this way. That makes it more clear. Come back to the center. And this is not a instructional purpose, but I'm just going to do this to get better information, to give a better demonstration. I don't know if it's because he's here in front of the group or his solar plexus is a little bit locked up. So we're just going to unwind his solar plexus a little bit. This in itself is a polarity technique to realign the body's energy field. Hold the arms straight, push up again. That's better. So, there are anywhere from 7 to 9 chakras, depending on what system you believe, and there's many more minor chakras. But the basic ones, there's the root chakra, and I test with the palm of the hand. Chakras should be free-flowing energy in the body. So I check over the root chakra, and he's free flowing there. His muscle weakens, his body responds, he's energetically connected there. Second chakra, third chakra, he's still shut down there over the third chakra. Because I go there, his muscle doesn't change. There's still some tension, maybe he's hungry. Fourth chakra, fifth chakra, sixth chakra, seventh chakra. So that's just to demonstrate your body can talk to you about chakras. You can show if there's a stress there or not. Thank you.
Thanks.
So, I'm just going to talk about a couple of techniques to protect yourself. And everybody may have their own ideas. These are the ones that I use or that I teach people to use in my office. Sometimes somebody has a person in their life that's a major stressor, and that person has cords attached to them. And those cords are constantly sucking energy out. You can cut cords. Cords are living, breathing things. They have a vital force and energy to them. And with your intention and a clear heart and a clear mind, and with the intent of love in your heart, you can reach and you can disconnect those cords. You can just believe you can do it, and you can do it. Another way to keep yourself shielded is to surround yourself with light, visualizing light. Many people use different colors. The most common helpful color is kind of a golden yellow. White light is a good light, and other people, depending on a chakra deficiency, do better with different lights. And the chakras correlate to the colors of the spectrum: violet, indigo, blue, green, yellow, orange, red, from top to bottom. So if you tell they're weak in a chakra area, you can have them visualize that color, and that will strengthen particularly that area and will help protect them. So violet being the crown chakra, red being the root chakra, and the others in between in that order. So you surround with light. And one of my favorite phrases, anybody know this book, The Flower Essence Repertory? So I'm going to get into a little bit later about techniques of working with emotions. Flower remedies are one of the big techniques that I use in my office. Edward Bach was an English physician a little over 100 years ago, and he was the first man to really develop flower remedies. He observed when he was among different kinds of flowers, he experienced different emotions. And then he started cataloging that. and he started making remedies from the blossoms of those flowers. And since then, a lot of other people have made groups of remedies from other different kinds of flowers, and they've tuned into them energetically and consciously, and they've seen the energies of the flowers, and they've written down descriptions of what it helps with. There's a particular flower that comes from the flower essence repertory from the Nevada Flower Essence Group called Pink Yarrow. And this is a useful one for energy protection, but the description it gives also describes a powerful technique for protecting yourself, and I want to read this. Every human soul seeks at its deepest level to be compassionate, to open your feeling life to others. The Pink Yarrow type needs to distinguish authentic compassion from overly sympathetic identification with others. For such persons, the boundaries between self and others are loose and ill-defined. This extreme openness predisposes your soul to bleed or merge with your environment, particularly the emotional aura of others. As a consequence, such individuals experience emotional confusion and oversensitivity, unable to identify which feelings originate from self and which come from others. Sometimes this emotional merging is unconscious. At other times, the individual willingly sponges up emotional debris. Such a soul is allergic to emotional confusion and disharmony, and they hope to dissipate this discord by internalizing it. So this is really a survival technique that many people learn growing up in a traumatic household. A Pink Yarrow flower essence type a Pink Yarrow flower imparts greater objectivity and containment. It teaches that true compassion, and this is the phrase that I like, true compassion comes from a heart which is in touch with its own spiritual strength. Such a person learns to give love that does not absorb, but radiate. It heals not by sympathetic merging, but by compassionate presence. So to me, the most powerful way to protect yourself is to have compassionate presence. To be there with a compassionate heart, caring. When that energy, that's really a divine energy. It doesn't originate from you, it comes through you, it comes from a divine source. You have compassion for the other person, you radiate love to them, and that creates an aura around you that protects you. So I think that's the strongest technique, and the biggest takeaway you could learn tonight, I think, would be that one. Now, let's talk about, I think that's my basic techniques. I also work with angels a lot of times. I believe that angels exist, and we each have angels with us. I believe for the most part, they're our relatives from the past or the future. And they're here to help us, but they cannot act without us invoking our agency to ask them to help. So we have to ask for help, and we're able, and we can do that. And angels can help protect you.
How do you do that? Just say it?
You can say it out loud or say it in your mind.
It's not like a prayer thing.
It could, well, you could call it a prayer, a meditation, or just speaking out to that spirit. They're there.
Gonna do it.
Good. All right. Now, let's talk about emotions. Who's heard the phrase, thoughts are things? Yeah, it's real. So, as we talked about the triad of health, each side of that triangle is equally important and valid. And those who know me and have worked with me know that at least a third of what I do is emotional clearing. I would say almost any physical problem has at least one emotional correlation attached to it, if not more. And many, many physical ailments can be cleared if you address the emotional side of the triangle hard enough. Same is true of all the other sides. If you are a powerful structural practitioner and you do your work impeccably, you will clear other layers of the triangle. You will clear chemistry and you will clear emotions by the power of your work and your intent. And I'm sure Michael has seen that in his work, and people break down crying when they get big releases, don't they? In your work? You don't let that happen. Okay, he has a boundary in his office on that. All right. But I know massage practitioners, other people who do body work experience a lot of emotional releases in clients, even when that's not their intent. It just happens. People release things as they're healed. But if you direct it intentionally, you can speed up the process of healing a lot. So there are many, many different techniques to address emotions, more than even us in here are aware of and more than I'm aware of, and I know many of them, and I use several of them. One of the major techniques I use is NET, neuro-emotional technique. And this technique and emotion code, which some of you have heard of, and others like it, all basically use their emotional correlations coming from the ancient Oriental understanding of the emotions correlated to the meridians. And as you know, in acupuncture or oriental medicine, there's 12 meridians in the body, and each meridian has an organ correlation, and it has spiritual and emotional correlations. Just a couple of examples, if I can read this in the light. Stomach, disgust, expanded importance of self, ego, obsession, egotistic, despair, nervous, stifled. These are some of the big words that can exist in the stomach. You can go to liver, depression, frustration, resentment, anger, repressed emotion. You can go to the kidneys, fear, dread, paralyzed will. These are some of the primary big organ correlations. Now, when you use these techniques, you'll find once in a while that those emotions sometimes lodge in a different organ, but those are the primary ones and the ways you usually find them. So, let's talk about it, or like I'm going to demonstrate, and I'll use my table if we need to lie down. If I don't, I'll have somebody sit. So, does anybody have a persistent area of their body, a joint pain, a neck pain, an arm, shoulder, or wrist, that just seems to come back and gets worked on and it comes back? Something is not resolving. Anybody care to? You raise your hand first. You want to come up?
Okay.
Yeah, are you comfortable coming in?
Yeah.
Okay. What area of the body is it?
Straight here.
Right there in your neck?
Car accident.
From a car accident. Okay, how long ago?
About a year ago.
Okay. And is it there all the time or does it come and go?
Most of the time it's there.
Okay.
I don't know that it ever goes, but
Okay.
sometimes it's worse.
Okay. Would you like to come on up?
Sure.
Grab this.
What did you point to, Cindy, that hurts? Right here. Okay.
So step up in front. I'm just going to look at her posture and just look at the area. So her head's turned a little bit to the right.
I do a little bit of repetitive injury with
Yeah.
what I do.
So point where it is. Right there. And if you turn your head right now, either way, does it hurt?
Yes. Really, yes.
More to the left. Okay. So turn and face this way, and I'm going to test you. Is it okay if I test you?
Yeah.
Hold the arms straight, push up. We're going to check her for the switching patterns to see if her body's polar. She's pretty clear. So I'm just going to touch the area. In applied kinesiology, muscle testing gives feedback from the body. Touching an area is called therapy localization. If there's an area that has a problem, you or the patient should be able to touch it, and it should create a weakness or a change in the muscle tone of the indicator muscle if her body's communicating with that area. If I touch a similar spot on the other side of the body, the arm is strong and intact. If I touch that side, it weakens.
So I
Okay?
don't want to know what it's saying.
Okay, well that's coming.
Saying loud
So
stuff.
I'm just going to feel the different muscles around there. I'm going to touch the scalene muscle, the sternocleidomastoid. I'm going to touch the lower down on the upper trapezius. I'm going to touch the levator scapula, the splenius. So this looks like an upper trapezius. So I'm going to be face this way, and I'm going to test the upper trapezius muscle. Lift the shoulder up. Does that hurt you to be there?
No, it's okay.
I'm going to pull the head away from the shoulder. You resist that. Okay, try the same thing on the other side.
Okay.
Lift the shoulder up. Lift
Okay.
this one up. Pull the head to the shoulder. You can kind of see the difference there. I'm putting the same force, and this side is definitely inhibited. That muscle is inhibited. Now, not every weak muscle has an emotional correlation, but many do. There is one of the first techniques that Dr. Goodhart discovered was called, or learned about to apply to muscle testing, was what he calls neurovascular reflexes. And these are reflexes on the body, mostly on the head, that correlate to blood supply to an organ. And the one right here, called the frontal eminence area, is a neurovascular reflex for the stomach. He also discovered that it also has a lot of emotional correlations to it. So, as a general quick test, I'm going to have you touch the upper trapezius area. She's got a weakness on the indicator muscle. I'm going to touch this, what we call the emotional neurovascular. It's an emotional test point. The muscle strengthens, so it suggests that there is an emotional correlation to that muscle. So now we've identified there's an emotion. Now I'm going to ask her body what organ system contains the emotion. So push up. So we'll check over the thyroid, over the lungs. I should maybe face forward so people can see. Thyroid, lungs, heart, stomach and solar plexus, pancreas and spleen, liver, gallbladder, kidney, just to show you the areas that I check. small intestine, colon, bladder. So we got a response over pancreas and spleen. So pancreas and spleen correlates to the third chakra. The emotional correlations there are failure, helpless, hopelessness, lack of control, low self-esteem, hopelessness. Okay, so this particular technique I'm using right now, the NET technique, has everything down to 3 categories. Any emotion could be about love, money, or you. Love meaning relationships, money meaning career, job, money, finance, world events, you meaning you, your identity. So this is love, this is money, this is you. So it's you about your identity, hopelessness. Something about your identity that you feel hopeless about, like I can't change or I want to change, I haven't been able to change it. Does anything come to mind there? And you don't have to tell details if you don't want to.
Oh, it's a parenting issue.
So okay, so with kids, something there. So feeling
Yeah.
hopeless about it. So bring that thought to your mind.
Okay,
Tell me when you're there.
in there.
Okay, so so it tells us we're in the theme. So this is a current theme. How old is it? How far back can you go and imagine those same feelings?
12 years.
12 years. I want you to close your mind, go back, or close your eyes. That's not your mind. Close your eyes, go back to 12 years ago and remember how that felt then. Tell me when you have that feeling. You have a sense of it? Hold the arms straight, push up. So we're still connected. Now we're going to ask the question, and this is a real key to real deeper healing. We're going to ask the question, if there's an earlier time or more original event in your life when there was a similar feeling that wasn't resolved. So we're going to ask her body that question, and I get a yes. So 12 years, you're still a parent. This is still in your parenting years, right?
Yeah.
So this is probably going to go back to your childhood. Can you think in your childhood, either for yourself or someone close to you, maybe a parent or a sibling that had a similar hopelessness, either about you or someone else in your family?
Yeah, maybe. Yeah.
So what would you think? What's
Probably
your guess?
about me.
So parents about you or a sibling about you?
Well, I was a middle child, so
Mhm.
whatever was going on with me was pretty much invisible. That's
Okay.
the way I wanted it.
Okay.
And so I think there was some loneliness with that.
You were lonely.
Mm-hmm.
Okay. So you're thinking your emotions back then, loneliness, about ever being seen or noticed or heard.
Yeah.
Close your eyes,
Important.
bring that thought to mind, me feeling important. Okay, there's some energy there. Now, having identified that, we're going to have you touch the organ of involvement, which is the spleen and pancreas. The other hand goes to the emotional center,
Okay.
right there.
This hand?
Mhm.
Okay.
And I want you to remember how that felt when you were a child, kind of middle child. I'm not really heard, listened to, not understood. And while she holds that emotion, I'm going to tap a few areas along the spine as a way to help release the stored emotion. Breathe in deep and out. Breathe in deep and out. Breathe in deep and out. Okay. Hold the arm up. Picture that same thought.
Okay.
Then we're going to ask your body, are there other emotions from that time? No. Look in my eyes. This goes a little deeper. Right eye to right eye into the subconscious. Other emotions from that time? No. Come forward to 12 years ago. Picture when you had those feelings 12 years ago. And let's see if your body's still holding that. No, that one clears. Usually if you clear the root one, the other ones often will clear out. Not always, but often. Come to the current time and the feelings you have, the hopelessness. You there? Okay, we still have some work to do there. So we're going to do the same areas, touch there and forehead. Forehead.
And for.
So picture the feelings currently, parenting, hopelessness. You have a sense of that?
Mm-hmm.
Breathe in deep and out. In and out. In and out. Okay. Push up, hold that picture again. Other emotions around that theme. Look in my eyes, other emotions around that theme. I want you to put it into a positive statement about that theme to challenge it. I want to challenge your body a little bit more. So say like, whatever this is, I believe it can be better, or I can accomplish this, or...
I believe it will improve.
Okay. I believe it will improve. Say that again.
I believe it will improve.
That she stays strong, she's congruent with that. Now let's go back and recheck our muscle. Let the arm relax. Tilt the head over to the shoulder, lift the shoulder up, pull the two together.
Wow.
Good. Try turning your head.
Wow, yeah.
Okay. Thank you.
Thank you.
Who knows body code or emotion code? You've heard of a lot of people. So emotion code uses it. It's a similar technique. Dr. Nelson, who developed emotion code, put the chart onto a magnet, and rather than tapping the spine, he uses a magnet as a way to initiate outflow of this energy out of the body. So I tell patients that emotions are like a charge in a battery. Your body really holds them like a charge, and they can be released just as easily. Just as a battery can be discharged, the emotions can be discharged. And there's many ways to do it. I'm going to show you 2 or 3 ways tonight. So I've shown you one way. Who else raised their hand? Did you raise your hand? Did you? Or was it you?
I did too.
You both did. You want to come up?
I'm going to be focused on this.
All right, come on up. And what's your name?
Jake,
Jake. Jake, what kind of a problem do you have? What area are you aware of?
neck pain.
Neck as well. And how long has this been there for you?
Since I was, I don't know, 15 years.
So a long time. Do you remember an injury or how it began?
May have happened falling on my head
Okay.
on a trampoline.
All right. Is it a consistent pain or does it come and go?
It's probably always there, but it's more painful than
Step in front of me or
Sometimes
show me where it is.
mostly on the right, but sometimes it can migrate to the left.
Okay. Okay, I'm going to have you hold your arm up. Tilt your head back. Center your head. Pull your jaw back. Push your jaw forward. Move it left. Move it right. He's got a problem that's been there for so long, his body's compensated for it, trying to cover it up. Hold your jaw to the right. So he holds his jaw to the right and uncovers it. This is a lower cervical disc injury, which is going to have, I'm going to use my other table because I'm going to be lie down because I'm going to use the neck flexor muscles to demonstrate this. Thank you. And I think the camera can get that there if he lays down.
Sure can.
Okay. So before you let him, just sit down, and I want you to either move or touch or demonstrate how you notice the pain.
Notice it. I'm feeling more on the left right now.
When you go back, you feel it more in extension?
No, forward,
Forward, you feel it. And is it about this area or on that side there, about that part?
up, left, yeah.
Okay. All right, go ahead and lie on your back.
On the back.
So real common with neck injuries is damaging an injury to the cervical spine. A lot of the pain emanates from there. I'm going to have you lift your head up, turn right, push up into my hand, hold your jaw to the right, push up again. That one's fine. Let's try that on this side. Hold the jaw to the right and push up here. Okay, keep your jaw centered and push up. Now do the jaw to the right again. Hold it there. So the scalene muscle weakens on the right, push up here and jaw right. And the sternocleidomastoid muscle is very weak, so that's really the muscle we're going to focus on. So I'm going to have you hold this arm up, take your hand and touch, or just lightly pinch the belly of that muscle there. So his muscle weakens, so we know there's some stress in that muscle. We'll go to the emotional neurovascular. Does it respond? Yes. So now you can let go. And I'm going to do the emotion code technique. Rather than scanning the organs, you could scan the organs to identify, or he has a chart where he has it in columns and rows by organ and emotional correlation. So this is column A or column B. Column B, row 1, 2, 3. Row 1, 2, 3, which is the same category that Cindy was in, which is, no, it's 3, it's this, I'm sorry. This is, row 3 is lung or colon. So let's see, in this case, is this lung? So, confusion, defensiveness, grieving, negative self-talk, negative self-talk. So, who understands that phrase? So anybody read any of Dr. Amen's books on the brain?
Yes.
What he calls the ants? Yeah. which is negative talk. So, as a younger kid, when you had this injury, do you remember having negative self-talk, things that you would say to yourself or about yourself that were derogatory or negative, or like, I can't do this, or I can't do that, or I'm stupid, or something like that, or I'm not smart enough, or I can't get this, or...
Sure, I was a teenager.
Uh-huh. Any big ones come to mind?
Sure.
Okay. So is that a phrase that still occurs to you from time to time?
Yeah.
Okay, so I'll just close your eyes and picture that thought. Okay. So are you thinking of it currently, or are you thinking of it back then, just now?
Back then.
Back then. Okay, go there again, go to that thought. Okay, so negative self-talk. Could be stomach, it could be spleen, it could be colon, it could be lung. So I'm going to have you keep your hand over the lung region. Now I'm going to have you sit up so I can do the magnet. So this is the emotion code technique. So you hold, he doesn't have you hold, I like to have you hold the organ system, and I still have him hold the emotional reflex. Like that. Hold that thought in your mind. Tell me when you're there.
I'm there.
And we just run the magnet down the spine, governing vessel meridian. Dr. Nelson explains that the thoughts come up into the brain consciousness, and we're pulling them out down the governing vessel 5 or 6 times. Okay, hold this arm up, take the hand away, think of that thought again. Good. Now come to present time and think of a time recently when you might have had that thought.
Okay.
Good. Lie back again. And let's just check the muscle. Lift your head up. Turn left all the way, jaw to the right. Push up into my hand. And that's real solid. And go ahead and sit up and try your head turn and see how that feels.
It's not as tight.
Good. And that's just one thing I would do, but it can clear a lot. Thank you. Let's see. Anybody else? I'll do one more demonstration. Pick a different body part, something without a neck, a joint, an arm, a hand, a knee, a shoulder. Anybody?
I have a body parts.
We can do both. You raise your hand. Come on. Do you want to?
Oh, I have, okay.
Which body part are we looking at?
My leg.
Leg, okay?
And I feel a little shy doing this. And it's right here. I broke my leg a couple years ago down here, so I have like metal and stuff in my leg.
In the ankle or more higher up?
Both.
Both?
Tibia fibula
Okay.
or tibula fibia.
Tibia, fibula.
I didn't go to the same school as you guys did.
Okay.
But for some reason, it hurts here. Always, always, always.
So the inside of the left knee, the right knee.
Right here.
And is there a particular movement that makes it most apparent?
When I put my pants on in the morning.
So do you lift up like this to do it? So is it or do you
Yes.
bend over to do it?
I don't bend over, I lift up.
You lift it up. So
Ow.
is it the lifting that you feel it?
Yep.
So right now you have a little sense of it when you lift. Okay, so I'm going to have to keep you standing for a minute, and I'm going to come over and
I would prefer to stand.
all right, face. Well, let me see. Let me move this. Well, we'll have to sit down. I'll have you sit on the stool. So let's go ahead and move it. Would you move this back for me out of the way? Thank you. Okay.
Oh, yow!
Okay. Not so much here.
Yeah, there too.
All the way up.
Okay, so it's going to be like from here to here.
But there's no metal in that part, and that
No,
wasn't
it's
fractured.
weird.
Okay. Hold this arm up straight, elbow straight, push up into my hand, straight. Bring it a little closer to the front, push up. So I'm just checking the back of her foot.
You're a little rough, man.
Sorry. She weakens at the calcaneus.
Uh-huh.
She weakens at the medial collateral ligament or the medial meniscus. Leave the arm in position. I'm going to do an external rotation on her tibia. That weakens her. I'm going to do an internal rotation on the tibia. That doesn't weaken her. Keep pushing up. Good. So I'm thinking muscles that hold the tibia in proper position. Popliteus, medial hamstrings. It's the medial hamstrings. Push up again.
Fine.
So it's the hamstrings, a couple divisions, so it's the inner portion of the hamstrings, which attach at the ischium at the top, and that is also displaying weakness. All right, so in a moment, I'm going to have you put your hand on your forehead. So I'm going to touch here.
Okay.
Now to put your hand on your forehead. Okay, that changes. So there's some connection there.
Right
Now
on.
face toward me. So we're going to ask, well, let's see if we can get the camera. Push up here.
Oh.
So we're going to check throat. Keep pushing up. Throat, chest, heart, solar plexus, gallbladder, liver, pancreas, spleen, kidney. Kidney.
I did have kidney failure when I broke my leg too.
Wow. So I'm going to refer to my chart here. So kidney is row 5 on the emotion code chart, column A, column B, conflict, creative insecurity, terror, unsupported terror. Okay? So,
I'm breaking my leg.
right. So how did it happen? Or would you rather not say?
No, I'll tell you.
Okay.
My husband had recently left me for another woman,
Oh, okay.
and I was at the courthouse filing for divorce, and I had a dress on. I looked really pretty. I had a dress on and I had high heels on because you have to look good when you're filing for divorce or you'll get judged. And so it was raining and I had high heels on and I was going up the stairs and there were no rails and I slipped and fell and broke my leg.
Okay. What do you remember feeling in the moment?
When I broke my leg.
Yes.
Fear, absolutely. There was
And
no one around.
And I'm afraid of what?
I'm afraid that I've hurt myself and it's going to change my whole life.
Okay. So I'm afraid I've hurt myself almost irretrievably. This is going. I won't be able to fix
I
this.
could tell it was bad.
Okay. So we'll ask: is it that fear? The fear that I'm kind of broken beyond repair? I've damaged myself, and there's no future here. That's not it.
Didn't think so. Keep trying.
So it could be. How about the divorce proceedings? Was there fear about that?
Yeah,
What was the fear there?
just that I was getting a divorce. That's a scary thing.
Okay. So it's like there's
And
an unknown
I was
world.
kind of crushed.
Crushed. Okay.
Mm-hmm.
So fear because of the divorce. I'm not wanted. I'm rejected somehow. Fear of rejection.
Yeah, yeah, probably.
Okay, so terrified of rejection. So we can do a whole bunch of stories around that, but let's ask this question. Is there an earlier time or more original event in your life in which there was a fear of rejection that was unresolved?
Yeah.
Everybody says yes. Do you know when that was?
Oh, yeah.
You don't have to tell us details, but if you want to, you can, or you can just picture it and tell me
Should
the
I?
That's up to you.
Tell everybody else. My first husband turned out to have a whole other family. He was married to someone else.
Oh my goodness.
And I had 5 kids with him, and I was married for 17 years. Then I found out that he had another family.
Wow.
So yeah, that was a little frightening. And so getting another divorce based on being left for yet another woman.
So the first time fear of rejection, I'm rejected, that's not it either.
What?
There's
I
something
didn't
before
think so
there's
because
something
I've
before
never
that.
really rejected that often.
Yeah.
What else would it be?
So I'll show you another way to get
Okay,
through this.
okay.
How old were you at that first divorce? Or the
First divorce, I was 32.
So her subconscious mind knows all the answers to this information, even though her conscious mind might not.
38, sorry.
So 38. So I'm going to ask if the fear we're looking for, the original fear of rejection, is 30 to 38,
Okay.
20 to 30, no, 15 to 20, 10 to 15, 5 to 10, conception to 5, 4, 3, 2, 1, birth, womb, conception in the womb. Her body says it was in the womb.
That's
Fear of
weird.
rejection in the womb. So who could you be rejected by in the womb? You could be rejected by mom.
Okay.
Push again, rejected by mom, rejected by dad. Depending on your spiritual belief system, I believe that we come from a spiritual place before, and sometimes that's a hard separation. I fear that my spirit family's rejecting me as I'm coming here. That's even not it.
Oh dear, I'm on a hard case.
So the other option, which is one that shows up fairly common, is called a vanishing twin. I'm afraid that a twin rejected me.
Oh,
Okay, so the research says that about 70% of all births begin as twins, but only or of all pregnancies begin as twins, but only a small percentage of those come out as twins in real life. So the twin is there for a short time, a few weeks, a few months, and it resolves or resorbs, and that spirit was there for a while and then leaves. But that connection, it could be like a soulmate connection, it could be a brother-sister connection, and there are emotional ramifications of that separation even in the womb. So your body
Interesting.
suggested there was a twin in the womb. So hearing that, does that bring up any feelings or thoughts in your mind?
I do know that my mom
Mhm.
was very morning sick,
Mhm.
and she thought she had miscarried.
Okay,
Maybe she didn't. I don't
Okay.
know. I don't know. This is deep.
okay. All right.
It was only 29 years ago.
I know you'd think I'd remember.
So what are the options in the womb of the twin leaving? I'm afraid that I wasn't good enough. I'm afraid that I wasn't good enough. I should have been
That
able
is
to save
weird.
him, keep the twin. Okay, so you don't remember that, but I want you to imagine how that would feel.
Okay.
You're
the
making
same way
this
I feel
journey.
when I can't rescue someone,
Yeah, exactly. There you go.
and I'm a little bit rescuey.
Okay. So now, have a seat. I'm going to show you the third technique I use for releasing the emotion.
Thought I'd been on the floor.
I use a polarity technique, which uses the magnetic energy in my hands to pull the energy out of her body. Face this way a little bit. The left leg has the most negative polarity in the body. The left hand has the most positive polarity, so I can use the positive polarity. You can leave the leg out if you want. Has the most positive polarity. We'll actually attract that negative energy out of her body once we've brought it to the awareness. And it drains into my hand, through my arm, into space. Unless I have the same issue and I haven't resolved it, it's going to go into me. That's the other thing I didn't tell you about energetic protection. If you have unresolved issues, you will pick up that energy from another person. So that's a good way you can learn that I have that issue unresolved, because I'm walking away with, I have to work on that one. And I feel tingling as this energy flows.
Do ya?
Yeah.
This is the most fascinating thing ever.
Do you feel anything?
My heart's kind of poundy.
Okay,
I'm just thinking.
stay seated for a
I've
moment.
been to therapy and stuff, but how would I be able to say I lost a twin? I mean, they can't help me. They don't know that.
So a few do, but push up again.
It's pretty
Trippy.
impressive. It's pretty cool.
Isn't it?
I've done a lot of with emotion code
Cool.
myself. So.
All right. I was good enough for my twin. Say that.
I was good enough for my twin.
Okay. Other emotions from the womb. Look in my eyes. Other emotions from the womb. There's one more emotional piece attached to that. Let's find it. Push up again. Keep pushing up.
Okay.
Push hard. Ovary. Ovary is row 6. Push up again, column A, column B. Pride, shame, shock, unworthy. Unworthy. I wasn't good enough.
For the twin?
Yeah.
So,
Have you ever-
so the twin left me?
Well, that was your feeling. That's not the reality of the truth. That's your feeling that you were left with.
Okay.
That was your interpretation.
Okay.
So can you imagine feeling unworthy, like I wasn't good enough? Yeah.
Yeah.
So go to that feeling. We're going to drain off that emotional charge.
Let's take it. Imagine how worthy I'm going to feel now, guys.
Yeah. Okay. I was good enough for my twin.
I was good enough for my twin.
Look in my eyes, other emotions from the womb. That's better. All right, stand again. Step forward. I'll stabilize you. Try putting on your pants. Just do the movement.
I could take them off.
That's all right.
Okay.
Just imagine. I'll do it.
Son of a gun. Are you joking me?
That's great.
Oh my gosh.
Hold the arm straight. I'm just going to check down there. Push up. Yeah, that feels a lot better. Good.
That is the most awesome, weird thing in the world. That's really short time.
Michelle, do we do questions now or after Julie talks?
Let's do now.
Okay, any questions?
How long would an adjustment like that hold?
That particular issue will usually not come back. Now, if there are other factors causing the weakness, they may come back, but that won't. Yes.
How long before you get to this intimate of a depth with a new client?
Sometimes the first visit, because most people come prepared. They've been told to somebody, they know what I do. And so I judge how they are and I go right into it, or it waits sometimes. Some men never get there.
Wow, that's great.
Yeah. Any other questions?
How long have you been studying the emotion code?
I did my first seminar with Dr. Nelson about, 7 or 8 years ago. And I've been studying NET for 25 years, and before that I was using flower remedies for 35 years, and a long time. Thank you.
I'm here to talk about yoga tonight. So how many of you have experienced yoga before? Most everybody. Okay, so you know a little bit about what yoga is, obviously. But I'm going to just go over that quickly. So yoga basically means to unite or to yoke, or essentially to bring to integrate all parts of your being fully, is what yoga really means. Yoga is about 4,000 years old, give or take.
Wow.
1 or 2 years. Yoga and Ayurveda, they are sister sciences. They work in tandem with one another. I'm also an Ayurvedic counselor. And they are the oldest form of health care in the world. In fact, Alexander the Great fired all of his physicians when he went to India, and he hired all Ayurvedic practitioners to take care of his health. Yoga is a holistic approach, which means similar to, like my husband talked about with the triad, it addresses all the different aspects of your being. Okay, it doesn't eliminate one or ignore another. It doesn't specialize on one. It basically specializes in all of them. Yoga is not just for health and healing purposes, but is also for basically catapulting your mental, physical, and spiritual potential into a whole nother dimension. It is for men, women, and children of all ages. Okay, so it doesn't matter how old or young you are. In fact, this picture here is a picture of me with my mother, who's 86 years old in that picture, which was last year. She's pretty good, huh? Yeah. She, I introduced her into yoga. She's actually follows a particular guru in India, and she has since I was about 13 years old. And meditates 2.5 hours a day, still does to this day. But she'd never done yoga, and I got her into yoga. And she was begging me to put a yoga video together, and I says, fine, but you have to be in it. So this is a picture of us right after I filmed my gentle video for the first time. So there was a study done in 2016 by Yoga Journal. Some of you may have heard of that. It's a national magazine. It's one of the top yoga magazines there is. And they did the study with YogaAlliance.org, which is an organization nationally that actually globally, in fact, I went to India to do another level of training, and they gave me a Yoga Alliance certification, which is United States based. And it basically is an organization that controls the quality of schools out there that teach instructors, and so that it's really good quality. They did a study together, and in 2016, 37 million people practiced yoga in America, which is up from 20 million in 2012. And as of right now, it's well over 40 million at this point. So basically what I'm saying with that is yoga's been around for 4,000 years. More and more millions of people are practicing it. It's not going anywhere. And the reason it's not going anywhere is because it's really effective in what it does in helping people. So yoga's main attraction is improvement to health and its stress-relieving properties. I have a little waiver form that all of the new students to my studio come in. They have a list of all the things of why they're there. Why are you coming to yoga? And the number one reason is stress reduction over flexibility, which is what a lot of people might think. I go to yoga to be flexible. 80% of yoga practitioners report having good balance compared to 64% of strong in their body and tone, opposed to 57% that aren't practicing yoga. 86% report having good mental clarity compared to 77% of non-practitioners. And that's just hard numbers from that study. Yoga is more and more being recommended by doctors. I have a lot of people come in through the door. I would say close to 3 to 4 times, three to four people a week that come in and say, my doctor says he hasn't been able to help me with this, this, or this, or this, and told me to try yoga. And I see that a lot. In fact, at my studio, we work a few different things than a lot of other yoga studios in the area or nationally, and we do a lot of detailed physical alignment with things called muscular energy, organic energy, loops, spirals, these types of movements in the body that are trying to create balance. And then with that balance, we create a steady pranic flow. Pranic just means life force. Your breath is prana, but there's a lot more to just prana than oxygen. But as you create a steady flow of that prana, it starts to release different things like strains in the neck and the knee, emotionally, all of that stuff. I've had lots of students cry on the yoga mat, a lot. So this is a study done from the Journal Archives of Internal Medicine in 2011, May of 2011. About 1 in 30 Americans use mind-body therapies due to a physician referral. Well, that's a pretty good, powerful number there. 1 out of 30 that practice those, a physician suggested that they do that. These findings indicate that the therapies may be becoming a more mainstream approach to healthcare, the researchers were mentioning. So this is starting to be, a little bit more mainstream. I think I pressed the wrong button. All right, so I've been practicing yoga since 2000 and teaching since 2001. So in the 17 years, I've seen lots of shifts happen in people's bodies. Everything from back and neck pain recovery that include disc issues, muscular strain, scoliosis. I do a lot with scoliosis. I probably have at least 2 students in every yoga class that I personally teach that has scoliosis. And I'm going to show you a really cool case study that we've got going on right now. Shoulder issues like rotator cuff tears, strains, imbalances, frozen shoulders, imbalanced posture. And you would probably agree with me that in the 21st century device world that we live in, we've got a lot of this going on. And so much of our posture here addressing, actually causing a lot of the neck and headaches and different issues. But a lot of the shoulder issues actually begin down here at the pelvis. So I have a term I call FSP, or foundational spinal position. And if you get that pelvis in its ideal position, elevation, depression, rotation, just even, then everything up above it starts to adjust and make its place. And so I work a lot with their pelvis position in classes. Things like knee issues due to muscular imbalance or mild injury, decrease in stress-related illnesses, everything from the common cold to the flu, those types of things that sometimes really just come from having, overworked and stressed out and challenged mentally. When we can eliminate those, sometimes those diseases eliminate themselves completely. Balanced blood pressure, libido, hormone function, sleep, and so much more. I actually have women that will come to my yoga studio. They'll come to classes for a month or 2 or 3. Something crazy happens in life. They're not in, don't see them for a while. And I see them come back and I'm like, oh, you're finally back. And they says, my husband begged me to come back to yoga. Because it makes a big difference. It really does. It just starts, I've actually even had women that have stopped menstrual cycles. And when they start practicing yoga, their cycles return again as the hormones begin to balance themselves. So here's a recent case study of scoliosis. You can see the picture on the left is the same outfit she has on the middle photograph, because those were both 9 months ago. You can see her pants on the front view. There's a little elevation of her right hip and depression of the left. And you can even see a little shift in her shoulders. Now the pictures on the right side, you can see the left and right, the changes that we have made since January this year. She's taking my teacher training. I do work in tandem with a structural massage therapist, and with exercises that I give her and with his manipulating the muscles. So basically scoliosis, 80% of them is muscular. Only 20% is actually structural, born with, incorrect, what's the word I'm looking for? Formation of the vertebrae. Yes, thank you. So only 80% is muscular. And so through that, one side of the muscles are strong, pulling the spine one way, the other side is completely asleep. So there's certain poses I won't let her do. You go that way, you can really twist far that way, but that's just causing even more imbalance. So trying to create a little more balance with that. And so she's already shifted quite a bit. You can see in the hips and the waist. Look at her neck. The one picture on the left, she hardly has a neck. And on the right side, she's actually starting to stand up straight. She's got a lot more work to do. She's got a little spiraling happening deep in her pelvis, her sacrum a little bit. So these are some yoga success stories that I've had. Mrs. Smith, she was an over 70-year-old woman that walked into my studio wheeling an oxygen tank. After a month of classes, she was able to just bring the oxygen monitor. Her doctor wanted to just make sure she was continuing that saturation of oxygen. And then pretty much after like 1 or 2 classes, she stopped bringing that. And she lost 20 pounds. A young mother of 2, she had a damaged sciatic nerve from an epidural. And if she stood very long, if she worked very hard, her leg would stop functioning. She couldn't walk. She'd have to lay on the couch, and she had a 2-year-old and a 4-year-old. And if you've ever been a mom, how do you handle a 2-year-old and a 4-year-old? So basically, I worked with her privately, and we were able to find exercises for her to recover function of the leg, but also exercises or ways to stand properly for her to keep that from happening as frequently. The competitive snowboarder I had come to class, he wasn't allowed to train anymore or compete anymore because of a bulging disc in his neck. And after 1 month, he was signed off. He felt amazing, and he was back at it again. CEO of Headwaters Incorporated, that's a local company here, I believe in Salt Lake. It's been recently sold. This gentleman had reduced blood pressure to a normal range from practicing yoga only once a week for 4 months. Christy was a college student. She had tried several anti-anxiety medications with little success, but with yoga she was able to be anxiety and med-free. And it's just crazy, the things mentally, emotionally, physiologically, or just plain physical. So I wanted to do a pranayama practice with all of you. So yoga includes basically these things. It can expand out. First, asana. Asana are yoga postures where you're working to create balance. I tell a lot of students that walk through the door, I says, I know you might think that you're here for flexibility, but the very first thing my job is to do is to make sure you're stable in all the really important joints and areas of your body. And sometimes we link those down into a sequence. If they're in a class setting, if it's a private, they may only have 4 or 5 exercises to work on. Pranayama, which means breath extension work, where you actually work on the breath in a different way, which is what we're going to do together as a class right here. Meditation, mindfulness, lots of different variations of meditation. It can be just mindfulness where you're sitting and listening. It can be repeating a mantra in your mind or out loud. It can be focusing on an object, staring at yourself in the mirror, staring at a candle flame, or mudra and mantra, which are mostly mental focusing. So I would like to do Nadi Shodhana. Nadi Shodhana Nadi means channel, and Shodhana means purification. So it purifies the channels. So a lot of these channels that my husband's testing when he's going through all the chakras and all these different things, these are channels. There's 72,000 nadi channels in your body. So if you think of the blood vessels are basically a nadi. Nerves are a nadi. And they just start getting more and more finite and subtle that run through your body. The Nadi Shodhana actually only deals with 2 different nadis. Pingala on the right side, Ida on the left side. So it's alternate nasal breath is one of the names it's given. It's a tube-like structure that carries, a nadi is a tube-like structure that carries prana, energy, intelligence, and consciousness through the whole entire physical body. The effects of this breath balance both hemispheres of the brain. So this is a great one for kids, for concentration, before tests, anything like that. It's invigorating or calming, and I'll explain why in a minute. Purifies the subtle channels, eases anxiety, and lowers your heart rate. I, in fact, had one private lesson with a student a while back. It had been her and her husband's third or fourth mission that they're doing, and I'm like, oh, that's kind of overkill. She'd had all kinds of things. She'd had lung cancer, had part of a lung taken out. She had all these different cancers. Her heart rate was over 100 all of the time, like even sleeping. She was very sensitive to medication. They weren't able to get her heart rate down for anything. So he's like, try yoga. So there's one of the doctor recommended. And within about a week or two, we were able to get her heart rate below 195. And that was a big deal. Her doctor was amazed. So this is one of the pranayamas that can really help to do that. Now, often these are done with a mudra, okay, because a mudra is a hand position, sometimes it's a body position that creates a kind of a channel for that energy flow to move through. And so there's two different ones. There's the Nasagra, where you take the index and middle finger and you rest it right here on the center of the brow. Some people call it the third eye. And you take the thumb and the ring finger. Now, this is always done with your right hand. Has anybody ever been to India? You don't use your left hand for anything but one thing. So the right hand is what you do. You handle the nose with, and some of you know what I'm talking about. The others, I'll have to find out another way. So you take the thumb and the ring finger to the bony edge of the nose, okay? And the fingers can rest here in the Nasagra. If you want to do the Vishnu Mudra, it might be more comfortable for your hand. You're going to bring the pointer finger and the middle finger to the base of the thumb, and then you hold here, okay? And then we're just going to kind of alternate which one. If you initiate the breath up through the right side is your Pingala, the Sira, or the sun side, the male side, the invigorating, the intensity, I did the right side first before I presented, because that's what I would need to have. Now we're heading towards the evening. So I'm going to have you all do it through the Ida side, the Chandra, the cooling, the moon side, the female side, which starts to cool and chill you down. But if throughout the day, if you feel like I can't get up in the morning, or I've got this thing to do, and you're just feeling lethargic, you can start through the right side and finish on the right side, and that will generally invigorate you. If you're feeling like you're going 25 miles or 25,000 miles an hour, like my husband, he works 10, 12 hours, and he comes home and he goes out and digs till it's 11 o'clock at night. That's how he stays so fit. And then he'll go for a run. So I'm like, okay, do a little left side first, okay? So that can be used for calming. So I have tissues, because you breathe in and out through your nose, and sometimes our congestion keeps us from breathing through the nose. So if anybody wants a tissue, yes, no, I'm going to take one.
Well, we won't know until we start doing it, right?
Well, just go. Do you feel like you have congestion?
A little.
A little? Okay, I'm going to take one. I'm going to pass it around here, and if just look behind you, look in front of you, see who wants one. Awesome. Okay, so let's try that mudra again. One or the other. And this just kind of helps us perform the pranayama. So again, either the middle index and middle finger rest at the middle of the forehead, right between the brow, or at the base of the thumb. Place the ring finger and the thumb finger on the bony edge, and go ahead and close your eyes. Take a couple of breaths through both nasal passages. So as you inhale, feel air travel up the left and the right side together. As you exhale, release out through both nasal passages. Do that 3 more times. Last round. Some of us breathe fast, some of us breathe slowly. Okay, so now close off the left side with your thumb. Just slide the thumb down. Inhale only the left. 1, 2, 3, 4. Close the left side. Open the right side. Exhale. 1, 2, 3, 4. Inhale, right side. Switch, exhale, left side. Inhale, left side. Switch, exhale, right. Inhale, right. Switch, exhale, left. 2 more rounds on your own. So after every exhale, you keep that side open for your in-breath. After every in-breath, you switch. Maybe try to extend the breath out. Can you take in for 6 counts? Both inhale and exhale. When you're finished exhaling out the right side, just keep your eyes closed, drop your hand, and continue just to breathe normally. So with your eyes closed, I want you to just notice if you're a little brighter sensation in your forehead, the top of your head. Some of you may sense or feel something there. Maybe down the neck, the shoulders, maybe your lungs just feel invigorated or open. Do you feel anything down those chakra channels like my husband was talking about, anywhere from the coccyx to the low belly, to the navel, to the heart, to the throat, forehead, or crown of the head? Awesome. And then just go ahead and open up your eyes. You can drop your hand. So how do you feel?
Good.
Oxygenated. Yeah. Woo! Awesome. So that's basically my presentation for tonight. I wanted you to experience a little bit of something, kind of get an overview of what I do and my yoga. What questions do you have for me? Yes?
How often should you do yoga?
Like I said, you can benefit that one gentleman who's a CEO once a week. I did privates with him and his wife. Now he attends my studio for the last 5 years. He comes about 5 times a week. But you can get benefit at once a week.
Okay.
But if you want to increase your benefits, you increase the amount of yoga that you do. And you want to definitely, there's a lot of different yoga out there, just like there's a lot of different ways to chiropractor. There's a lot of different ways to, be a physician or a doctor or a dentist. So,
That was my follow-up question, because how do you even find that? Because it's just, there's so many different variations.
there's
out
so
there.
many, I think all forms of yoga are beneficial.
Okay.
Are beneficial to some level. I have a lot of, I have a lot of ideas about different types of yoga that I think can be very harmful. Ones that really push you really hard, ones that are too hot that not only do the muscle stretch, but the ligaments stretch. And if all of you know all about ligaments, you don't want ligaments to stretch because they won't go back. Different things like that where it's more about, sometimes the Western world has taken yoga and we've put it into our Western way of thinking, which is no pain, no gain. And there are most of the time, the injuries that I take care of in the studio, at my studio, are because somebody's inquired it at some other studio. I'm the put you back together yoga studio. And so, if you go to certain ones where they're doing chin stand and they're constantly cranking their head up and blocking off those nerve endings coming out of the brainstem, I'm like, don't do that. We don't do a lot of those things. So.
Hear that again? What did you just do?
Just, a lot of yogas, they're cocking their head up and they're just pinching that. First of all, they're pinching off the trachea. So if you want to, yoga is so breath-based. You pinch that off, there's no pranic flow getting to whatever else you're working on. So
And where's your yoga studio?
it's in Alpine at the Roundabout, Lifted Life Yoga Center. Yes, lifted live. Any other questions about yoga or things you've experienced you have questions about?
What types of yoga do you feel like would be the best for relaxation? And
Yeah, gentle or restorative type yogas. Yeah, definitely. Yep. Anything else? No? All right. Thank you.